Well, I certainly thank Jolene and Marty and Marcus for inviting me tonight. Are we going to do the slideshow?
Yes.
Oh, okay, great. I'm sorry, I can talk for a while. That's never a problem. So, and I'd like to just draw attention to the fact that Marty Zersky is one of the founding members of Northland Healthcare Access, and she's with us tonight, and I know all of you know her well. So beyond everything else that you know she has done in the community, she helped get this program started and up and running. And so we believe that healthcare is a right and it's a community responsibility to help folks that are in need, that it's not a privilege. We live in the United States and we believe that everyone should have equal quality and quantity of healthcare. And since 1991, Northland Healthcare Access has invested over $35 million with partnerships in Clay and Platte County since we were founded. And so we do this now through about 8-9 different programs that I'm going to go through with you, and I'll talk about each one of them and how you can access those programs. And it's your neighbors, it's your family members, it's your friends that can access this. And just as Corky was talking, I've been in so many situations out to eat at a restaurant and somebody will see my name tag and they'll say, "Are you with Northland Healthcare Access? I just want to tell you, you saved my life and you helped me because I had cancer, I had no insurance or whatever health problem that they have." So we have stacks of thank you notes. So I'm ready for the next slide. We'll go ahead into the programs. So I want to talk about, it does take a village to make things happen. And you can never do it by yourself. And so we do it with all of our partnerships and our programs. So I'm going to talk about these partnerships and programs. We partner with the Platte County Health Department. They have provided over 1,000 encounters last year at their family healthcare center in Parkville. And actually they have some exciting news that they're actually going to be moving and expanding by the 1st of next year. So we're excited to be able to expand that. A crucial piece of this is as people come in for needs, they have other needs and they have those social determinants that are keeping them from having a vibrant life. And so we pay for half the salary. We support the social worker that is at Platte County Health Department so that they can provide those services. We also support Samuel, and that's in Platte County. And then we support Samuel U. Rogers. They have a clinic. They have 2 clinics in Clay County, one at the Clay County Health Department, and then one at with a partnership with North Kansas City Hospital, one on North Oak. And just to kind of explain to you what normally happens, Samuel U. Rogers is a federally qualified health center. And usually in a situation like that, the reason they get a higher rate of Medicaid, Medicare, and that way they can support those folks that are uninsured. Well, in Clay and Platte County, that you really need a mix of about 60% Medicaid, Medicare, 40% self-pay. In the Northland, those numbers are skewed opposite. So in order for them to be in Clay and Platte counties and have those facilities and those clinics, Northland Healthcare raises almost $500,000 to keep them here. So we support them. And the other thing this does, while we raise money for the uninsured, you have to understand that our Medicaid and Medicare population wouldn't have places to go because a normal physician's office will only take a certain percentage of Medicaid and Medicare in order to have a successful office. But that now opens because we support them for the uninsured. They're able to remain open, and they are then you have places where Medicaid and Medicare patients can go. So we'd be very limited in the Northland with Medicaid and Medicare if these two entities were not available to us. We also, a few years ago, started a program, and this was actually suggested by all of our local hospitals. And I'll speak to that and kind of give you an outline of how that happens. So this program, Northland Healthcare Access pays for 2 qualified mental health providers, and we locate them at the 2 primary care offices. Because when a person comes in for healthcare reasons, they could have many other mental health conditions, stress, substance abuse, mental health issues. So the idea is to provide a holistic care. So they can go in, the physicians suggest that they need some additional services. They can go right to that office and get those needs because it's right there in the clinic. So many times the people that we deal with are always in crisis. And so they're thinking about how they're going to get food for dinner. How are they going to get to work? Because they're going to lose their job if they don't get to work. And so once they leave the facility, they don't always come back. And so when we're trying to provide the holistic care at one location, we also partner with Samuel U. Rogers on their dental program. And of course, because of COVID, that's been on hold for the last year. Next slide. So we do a lot of very innovative programs. What Northland Healthcare Access tries to do is, and we look at it with all of our community and community hospitals, Tri-County, we look at the gaps in services. And then we figure out how to develop a program to serve those gaps. So I'm going to talk about a few of those. So we have a volunteer network. We have Northland Care is a volunteer network of physicians who donate everything for a primary care visit. So once a person is in the Northland Care program, they get free health care at a physician's office. That's the same as you or I who are able to afford that. And so we have a rotating list of people that get, because they get well, they go to work, or we get them on Medicare. Then we usually have about 400 or 500 people in that program. We have every physician's office in Clay and Platte County participate with us. Not every physician, but at least 1 or 2 at every office participate with us. So you can see what our numbers are. And so then we have Northland Care Plus program, which is a program, the hospitals came to us and said, you know, the healthcare as it is, people come in and they can't afford it. And then they come in and they can't go back to their physician's office because they owe a bill. So what happens is they go through the emergency room. So we developed a program and we set aside about 25,000, 30,000 in our budget to pay co-pays, ancillary services for our patients. And so we rotate about 15, 20 patients that's isolated in that program. So we have 22 patients in that program now. Next slide. So we also have this great care coordination program that I'll be talking about. And we do that through the Northland Care program and the Northland Care Plus. And we partner with the Clay Platte Family Medicine office, and we do their care coordination. They're the largest standalone physician's office in the Northland. They see over 40,000 patient visits, and about 10 to 15% of those folks are low income. So we have a contract with them, and so we work with those folks in the program that are low income to get them all their needs so they can continue to have preventive care and not immediate care. So you can see that. Next slide. So we have, through a partnership, our offices are donated to us, and they're at St. Luke's Northland. And they also donate this number to us. Remember this number. Give it to anybody that you think might need it. 880-6700. So we have a care coordinator, social worker actually, that works in the evenings. And so she returns calls within 24 hours. So we distribute this number and market it through the community. You need help care, call this number. So then that person on that line calls those folks back and helps them fit into the proper place where they need, whichever program is the best for them. So that kind of gives an outline of how many callers we've had through that program.
Can you speak into the microphone?
This one?
Either one, just as long as.
I'm trying to, yeah, I'm sorry. Okay, I'm sorry. So next slide. You can get it. Okay. So this is a new program. We actually started two new programs during the COVID. So, which is pretty unusual for a not-for-profit. So one of them is a prenatal grant. We actually got a grant from United Healthcare, and we have a prenatal coordinator that is office at the Samuel U. Rogers Clinic on North Oak and at Clay County. And so she meets with as many as 15 pregnant women every day. She had been on the job for 2 weeks when she got a young girl, 13 years old, that was pregnant. And she helped her through that. Not particularly, she didn't have a supportive family. She had a boyfriend, he was 16, very supportive. He was going to support her and take care of her at 16. But through that process, she worked with her, and she delivered a healthy baby. So that's what she does, is to make sure she has all the resources at her fingertips so that women that are underinsured and uninsured can deliver healthy babies. So you can see those numbers. And we just started this program in January, really in March of this year. Next slide. I think I've talked about it. So we kind of stepped out of our box a little bit for Clay County Commission last year, this year, along with United Way, and ask us if we know we're a healthcare entity, but could we step out of that box and help those folks that were affected by COVID with rent? Now, something you need to remember about this particular program, it certainly isn't just about those that rent. It's really about our business owners and our landlords that during that time, they still had to make their mortgage payments, but they weren't getting the rent. So we have been, to date, we have helped Clay County residents with actually, that's a little bit old. We've helped with over $650,000 right now. So with that, and that is the CARES Act funding through the Clay County Commission. And we've helped, I think we're up to about 150 Clay County residents. So next slide. So I can conclude, do I have more time or?
You got a little bit more if you'd like.
Little bit more. I want to talk a little bit. We have a board of directors, and how do we come up with these programs and how do we fill the gaps? We are very fortunate in the fact that all 4 of our hospitals sit on our board of directors, either at a CEO level or at a CFO level or a VP. So we have the decision makers at our table in a program committee. And that's how we develop these programs. And we look at gaps of services, and we're always open to be able to fill the needs of our community. We want a healthy community. And I might, since I have a couple more minutes, well, a few years ago, we started, there were our hospitals, along with our 2 health departments, Clay and Platte County and Tri-County, we started an organization called Northland Health Alliance, and we invite non-for-profits to be a part of it. And we actually do a community health assessment. We're in the process of actually our 3rd one. And from that, we develop a community health improvement plan. And the 3 areas that we have worked in historically: chronic disease, access to care, and behavior health. And that's it draws all of our community together at the same table, working at the social determinants that are needed in our community. So I'll wait. Maybe there'll be questions. Thank you so much for the opportunity. It is always a privilege to talk about Northland Healthcare Access. Thank you.